You all, today I have Dr. Herbert with me, and we are going to discuss physician burnout and disengagement, and I am here for it. Dr. Herbert, welcome to the Zen Effect Show.
Thank you so much for having me.
Yes!
And I love the name of your show,
Thank
Zen
you.
Effect.
Thank you. I like the way you say it. She said Zen Effect. Did y'all see that? But I like the way she says it.
Yeah, so my name is Dr. Lisa Herbert. I am the CEO and founder of Just the Right Balance, which is a coaching and consulting firm. So it's a company that I started when I started to realize, that we were embracing or facing actually this healthcare crisis of physician burnout and physician disengagement. So my background is I've spent 20 plus years in the healthcare industry as a family physician, also as a healthcare leader. So I really felt like I was beginning to see both sides of the equation, like what it was like to be a physician, but then also what it was like to be on the other side, being an administrator. And a lot of what I recognized was that there was this breakdown in communication between, clinicians and administrators. Physicians were burning out, which is what, we're going to talk about today. And also it was leading to this crisis of a shortage of physicians, which was then impacting healthcare access, for patients. So that was the whole reason behind starting, my company. But my background is, I'm a family physician. I was born and raised in Brooklyn, New York. I attended school at Upstate Medical Center at medical school, and then went on to do my residency at Mountainside Family Practice in New Jersey, and spent probably the most 20 plus years in Jersey practicing family medicine.
Excellent. Dr. Herbert, can you help us unpack what's really happening beneath the surface and why this has become a true health crisis affecting everyday people? When you were just speaking and you were saying, like, even for us to even get in touch with doctors, like, I've had to book 3 months in advance. I know
Yes.
somebody who their mother was an elder senior citizen and had like some serious health issues going on. And they
Yes.
literally told her, she made a call in 2025, and they said, oh, we can't get you until 2026, fall of 2026. Her mouth dropped like, I know that's not true.
Right.
But they're
Right.
like, yes, it is.
But yes, it is. Absolutely.
Wow.
Yeah. And I think that's the thing that I wanted to raise awareness about, right? Is the reason behind why this is happening. So it's happening because we are definitely in the midst of a physician shortage. And if we don't really get a hold of what's actually causing the physician shortage, which is physicians are leaving medicine because they are facing burnout. 50% of physicians actually go through burnout, which is a huge number, 50%. And it has
Wow.
been that way for years. So this is not something new.
Oh, this isn't new.
It is not new. It's been going on for years, and we just have not been able to find a solution to the problem. So, years and years of this going on top of physicians being disengaged, on top of the fact that, we at some time have to retire, right? So 10,000 of us retire a year. And it's really caused this access issue, which is why patients can't get in for an appointment, unfortunately, and it takes a long time to find a doctor. The access is a huge problem. Even here in Georgia, I don't know if you all
Yes,
know,
it
but in
is.
Georgia, it's bad, right? But we have counties in Georgia, at least 40% or so, where they call them maternal healthcare deserts because there are no OBGYNs in those areas, mostly affecting rural counties, but I mean, that's just unheard of.
How are you not going to have an OBGYN? Because women, like, you have to have that. How can you not have that in certain area? What do they do?
Yeah, right. So again, it's an access problem, but it's also why our numbers in terms of, maternal, unfortunately, mortality rates are increasing because women are not getting into care, when they need to in the beginning, or they're just foregoing care. A lot of times this causes them to travel very far, So yeah, so what do you do?
Wow.
Yeah.
Wow. I'm so excited for this conversation so we can really understand. So doctors are experiencing burnout. Did COVID contribute to this in even more of a greater, because you said this isn't new,
It's not new.
but I feel like COVID impacted it even more so. Can you kind of share that with us?
Yeah, absolutely. So, COVID has definitely impacted physician burnout because during that time, the numbers were even higher. Physician burnout was around 62%,
Whew.
right? So, it definitely had an impact on physician burnout. And I think it also finally brought it to the forefront. I
Okay.
think people started to realize that this was a true problem, it was a true crisis. Doctors started talking about it on social media. You started seeing, different posts about physicians working really long hours and not being able to have a break, the load, obviously, and just the mental stress, that was going on during that time. So I think COVID did definitely play a role in impacting physician burnout, but it has been going on for some time. And I think to understand it, you have to understand sort of the day to day of what physicians go through, and it's not just really physicians. It's obviously nurses. It's all people I think in the healthcare industry, but the day to day impact of being a physician is having to deal with seeing a lot of patients, obviously because of the access issue, having to deal with long hours, having to a lot of times internalize what happens to you on the job, right? So having to deliver bad news, having to see patients, unfortunately die, having to see all of those things that for a normal person would definitely impact their mental health, on top of administrative burdens of having to get things authorized for their patients and wanting to do the right thing and sometimes not being able to. So, all of that has created this huge mental load, mental stress on physicians that ultimately, projects itself as burnout.
So, could you walk us through what a day in the life of a physician is? Because I know I'm one to say, if I'm not able to get an appointment or I get frustrated about everything has to be on the portal, why can't you answer me? Like, what are you doing but just seeing patients all day in between? You should be
Mm,
able to answer me quickly. Clearly, with what you just explained, that's not the case.
right.
So, what does their day to day look like?
Yeah.
Because I'm thinking they're creating their schedule basically.
No, no. So for the most part, unless a physician actually has their own practice, if they work for a health system, the system is creating their schedule for them. So they have no control at all over their schedule.
Wow.
So,
Okay.
a lot of times we will get patients who are not happy, which we understand, but directing sort of the energy at the wrong place because we're really not the ones making out schedules. But yeah, I mean, the day in the life of a physician, I think, varies depending on what your specialty is.
Okay.
So I can just tell you from the standpoint of being like a primary care physician,
Yes.
the day in the life could be, you may start seeing patients at, 8 a.m., let's just say. So a lot of times, there's prep work that has to happen before you even start to see patients for the day. You want to look at your schedule, see who's on your schedule, make sure you're up to date with everything. You have messages as soon as you get in, right? So you have to answer messages, email messages, forms that have to be completed, all these things that kind of just are there, right? And then you start to see patients. And a lot of times, the time that we have, we would love to have more time, but the time that we're given to see patients, 15 minutes, maybe 20 minutes, which is not a lot of time to really create a bond,
Yeah.
with patients over
It's
time.
not.
And then in between those, times when you're seeing patients, you might get interrupted from a phone call, or you might have to, see the next patient in the next room before I see you because that person's having chest pain and I have to kind of see them first.
Yeah.
So unfortunately, you may have to wait a little longer. So there's just a lot of moving parts that kind of go on, during the day. And then when you're done for the day at 5 o'clock, you're not really done because then you're answering again email messages, things that have come in during the day. You have to finish your notes, which takes a long time, as well. So you may not finish until 6, 7 o'clock at night. You're getting home. And then again, depending on what your specialty is, you may or may not take call that evening. So now I'm on call past 7 o'clock. Again, answering emergencies, if I'm a surgeon or if I'm a OBGYN, I may get waken up in the middle of the night to have to go do a delivery, right? So I mean,
Yeah.
you have to take all of that into account of the day in the life is a long day. It's a
So
long day.
it sounds like, because with the burnout, it sounds like there's not work life balance really. especially as an OBGYN or surgeon, like you said, you may have to get up in the middle of the night. So my thought is, where do they get to spend time with their families, hang
Yeah.
out with their friends, take vacations? Because with what physicians experience on the daily, like seeing somebody die,
Mm-hmm.
and I'm sure that hits different too, because as a physician caring for that person, it hits
Absolutely.
on a deeper level, because
Yeah.
it's like, wow, like we've literally tried everything. So
Yeah.
to see them and have to break this to their family.
Yeah, yeah. And then a lot of times you're not given the room to actually, have a moment,
Mm,
to just kind of take it in, or at least to kind of express the grief in some way, because, we're kind of just moving along, and, day to day we're just kind of internalizing what happens and not
mhm.
really talking to somebody about it, or at least taught how to kind of deal with it, right? We're just kind of taught usually just to kind of just go on and just move on to the next patient, or try to suppress it, right? Try to
Yeah,
push it down.
yeah.
Yeah, yeah,
So when it comes to what is happening with the burnout and the disengagement, is this also contributing to the disparities of African
yeah.
Americans? Because I feel like it's so important to speak to that, just because with the disparities, we're always talking about how we don't trust the medical system, and that's it. There's a
Mm-hmm.
lot, and we understand, we know what the history looks like, but there's a lot of projection, and
Yes.
we don't really know what else is contributing to that. And it sounds like this is.
Yeah, yeah. It definitely is. I can talk from both personal and,
Yes.
a professional standpoint. But even from a personal standpoint, I have family members who have had obviously to utilize the health system. And being on the other side of it sometimes, when you get to experience sort of what that feels like or what that looks like, I think you can kind of look at it a little differently.
Mm,
So, I recently had, one of my family members was hospitalized, and I knew from a medical perspective what should have happened, right?
yeah.
So that's kind of scary. I think being in that position, knowing so much, and then also just having to be that advocate for your loved one. And I was having the conversation, with the particular clinician at the time, and is expressing my concern about certain things and how I kind of wanted certain things to go. And I could just tell that they were just depleted. They were just spent. Like it had to be, maybe it was a long day, and that person just wasn't hearing me at all. So I had to kind of put the hat on of, okay, my physician hat of knowing what burnout's like, but
Hmm.
also, the hat of being the family member, knowing that, this needed to look differently, and make some choices, and, some things in terms of that person's care. But that made me really sort of want to delve into this even further, because it does impact health equity. It does impact disparities, right? Because if a physician is burnt out, if they're disengaged, number one, they are detached usually. Um, and they also are not able to provide care if they're going to leave the system because of the burnout and because of the disengagement. So if you're leaving the system, especially if we're talking about, black and brown physicians
Yeah.
leaving the system, right? We already know what sort of impact that's going to have on vulnerable communities, right? Studies have shown that, patients who are black patients actually who are treated by black physicians do better. We know that. The studies are there. We also know that, we are a small percentage, right, of the population. So if we're leaving, and we already know that there's an access problem, and we already know that there's a health disparity issue, we're just creating a bigger problem by not having, physicians there,
Which we've created,
which we've
like which
created.
we have created. So, what is the solution here? Like, what are some solutions? What do we do? And especially with being on the patient side of it, what do we do? Like,
Yeah.
and you have so much telehealth and things, because I would love to hear that from you as well. Before we get to the solution,
Mhm.
these telehealth, they seem like solutions
Mhm. Mhm.
because they advertise, well, if you're not able to get to a doctor or what have you, do this. But To me, that's kind of scary in a way because
Mm-hmm.
the doctor's not able to be there with me and actually check me out. It's based on what I'm reporting to them and how they see me over a camera.
Yeah. And I get it. Yes, absolutely. Yeah. I think there's a double-edged sword there. I
Hmm.
think that telehealth definitely saved us during the pandemic
Okay.
because we were just not able to, see patients, right? Or
Yeah.
have them come in because of all of what was going on. So I think that it definitely did kind of save us in a way. I think it does help in certain areas too, in rural areas, again, where there's access issues, right? So at least if you can't get in to see a physician, you can at least talk to the physician,
Okay.
over telehealth, and then they can hopefully get you to the next level of care. Right.
Okay.
So it creates an entry point almost, I think, for
Oh,
patients,
okay.
yeah, to be able to come in. I would never substitute it for care, but I think it is a great, like I said, entry point for patients, at least to start with. And I think most physicians know when to tell you you need to come in, right?
Yeah.
Because if you're saying that you have, obviously shortness of breath or chest pain, I don't think you should be on telehealth anyway. But we're going to tell you to call 911 and go to the emergency room, right? Or if you are, coming on telehealth and you're talking about something that, like you said, I can't visually see, then we're going to say, well, you need to make an appointment, but at least I can start here with you and we can do some of these things before, until you can get that appointment.
Did you all hear that? I'm being so serious because I feel because there are so many individuals who have a fear of doctors, fear of medical, won't go, especially many of us, won't go and will utilize that as a substitute.
Mm-hmm.
And it's there for the access. So you can
Mm-hmm.
access somebody
Mm-hmm.
so
Yeah.
that you can get support and then you can move on to the next thing,
Yeah.
right? Because that alone can save your life.
Absolutely. Yes. Yes. Absolutely.
It
Yeah.
it's us staying ahead.
Yeah.
It's us staying ahead. When you notice something, get it looked
Get it
at.
looked at.
I
Exactly.
utilize doctors as a reference point. Get it looked at, get it checked out, so at
Mm-hmm.
least you know what it is and where to go instead of letting it fester and
Yeah.
then you end up dying at such a young age. And we're seeing so much of that that's taking place,
Yeah.
you
And
know?
you're right. I mean, I think, obviously the trust issue is still there.
Mm-hmm.
But I do think it's important for patients to understand that we're here to be your support system. We're here to collaborate with you, right? It should never be a directive that, I'm
Mm.
telling you what to do. It really should be a collaborative approach to your healthcare. So if you have some issues that you want to bring to your physician, bring those with you to your appointment. Research sort of what you might feel might be going on. A lot of time that's really helpful to us. And I think sometimes it's just the way in which you bring the information, to physicians that may be more helpful in terms of you having that rapport and developing that trust and, sort of getting into that collaborative sort of care.
So
Yeah.
we're in this crisis. Dr. Herbert, is it all loss? Because it just seems like when you say it's not new, this is something that has been happening. What I hear, because we didn't catch it at a whisper,
Mm,
now it's festered to the point we're in a crisis. We're in a
yeah.
really serious situation. And that's scary because this is our health we're talking about.
Yeah. Absolutely.
And the disengagement, like the connection not being there. Like when I think disengagement, I feel like just being numb to it,
Mm, mm-hmm,
right? Like
mm-hmm,
just being
mm-hmm.
numb. You're just so separated from it at
Yeah.
all levels.
Yeah. Yeah. And I think that, even in the face of disengagement and
Hmm.
even in the face of burnout, physicians will push through that. That's just how we're
Okay.
wired, right?
Okay.
And so I don't want it to appear as if those two things impact your care negatively. It
Okay.
can, but I think that for the most part, most physicians kind of still push through that because at the end of the day, we just want patients to be healthy. We want to cure, we want to heal, we want to do the thing that we said we were going to do, years ago when we made the decision to become a physician. So I think it's just important because when we talk about the disengagement and the burnout, yes, it can impact patient outcomes, but it's impacting the access, which is the issue because physicians that are surveyed, 40% of them are saying like within the next 5 years, they're leaving medicine. Right. So that
Completely. They're saying
completely,
they
like
are
I'm just done,
done.
done, done.
not moving to something else in
Right.
medical, not they are just
They're
done.
just done. Yeah. And we know for women, which is so important too, because women physicians have a better, mortality in terms of helping patients, right? So our mortality rate is lower, actually, women physicians.
Hmm.
So women physicians, when they first come out of school, out of residency and complete their residency, within 6 years, most of them, or 40 to 50% of them, are deciding to either reduce their hours to part time, which is again impacting access,
Yeah.
or again, they're deciding to leave. So a huge gap, is being left as well. So you're right. I mean, we should have probably talked about this when it was a whisper and not, as a fire now. And I think that the system has tried to do certain things to
They
help.
have? Like what?
I think initially when they were looking at burnout, they were looking at it as a wellness issue. So what can the physician do to get to be well,
Mm-hmm.
right? So do you need to, meditate more? Do you need to take some time off? Like, do you need to exercise more? Is it about you eating healthy? And all of those things are great, but it's not actually solving the problem, right? But and
Clearly.
by clearly by itself.
We're in the crisis.
Right.
Yeah,
So, and
yeah.
there's been a lot of physician wellness programs that have been instituted, so like I said, there are things that have been done. And I think in some cases, maybe it has helped some, but it really still hasn't moved those numbers. So I think we have to start looking at what else can we do in addition to physician wellness that's going to help resolve this problem, help solve this problem. And a lot of it, from my understanding or from what I've seen, is that
Mm-hmm.
it has to start within the system that the physicians work, under. It has to start from within the system. So, my approach usually is that when I work with health systems who are trying to increase their retention and decrease burnout and improve patient outcomes, I look at it from like a two prong approach.
Okay.
So, one is I think it's really important for physicians to learn how to be leaders, like how to just, take on those leadership skills, which we're not taught in medical school. We're taught to be great clinicians. We're taught to be, great at what we do, solving problems, great diagnosticians, but we're not really taught the art of negotiation, how to influence others, how to get our decisions heard, how to advocate for our patients, all those skills, which I term leadership skills, we're not really taught. So one of my approaches is to come in to make sure that physicians learn how to be great leaders through a leadership development program. And I actually had wrote a book about it too. It's called
Yes.
Physicians Rise
You
Up.
sure did. Yes.
Yes,
Tell us
yes,
about that book.
yes.
Yes, Physicians Rise Up. You sure did.
Yeah, so it's a guide really to just introducing physicians to what it means to be a leader. And it's a
Yes.
it's a small guide that kind of just gives them all the things that I just talked about,
Yes.
what are the skills that they need, how do they go about it. So I wrote that book, Physicians Rise Up, which I think is a great entry point, for physicians. But then going through just the leadership development skills, and then the second approach is really to transform the culture. So, how do we transform the culture to what I call like a coaching culture? So, it's not just like the leader is telling you what to do and it's
Mm-hmm.
very authoritative,
Mm-hmm.
but it's more about how are you helping your team and your employees to thrive in their roles? Are you asking them what they need, not just telling them to go do those things like yoga, meditation, and, and all those, right? But how do you help them to thrive? Are you providing resources, for them? Um, are you coaching them through difficult situations? Do they know that the tools that they need when they are, in the midst of a crisis or a challenge? So I think we need to just start working within systems to help kind of one change the culture, but then also, like I mentioned, just developing, physicians to become leaders.
Will you give an example for what that looks like? Because I'm sure there are physicians listening, or even loved ones, or friends, or wives, husbands of physicians, listening, and they hear that. But
Mm-hmm.
what does that look like, especially when they've been utilizing more of that authoritative format?
Mm.
What would that look like? Like, what's something they could implement today to start making that shift and that change?
Yeah, that's a good question. So I like to say, like, when I'm, in front of a patient, some of it's very simple. I think we just kind of, a lot of times are on autopilot.
Yeah.
But, as simple as, so my approach would be if I have a patient and before I even go into the room, right? And we all do this. You want to know like why the patient's there.
Yes.
You also want to know a little bit about them. Did they just have a birthday? Like, did something just happen, that was, monumental maybe in their life? So when I go into the room, I'm finding that thing, basically, it's finding that thing that I'm connecting with
Okay.
them. So whether it's a recent birthday, whether I notice that they have a new hairdo, or if they have on some cute shoes, if they're smiling, if their loved ones with them, something that I can connect with before I sort of get into the why you're here sort of story, right? So I think it's really making that connection. And then after that, it's really, once you find out sort of what brings them, to the appointment, you want to ask them, well, what's most important for you? Because I can tell you what I think, but what's most important for you for us to really talk about, solve, and cover today? And that's the
Gosh, I
thing that
love
I really
that.
focus on, right? Because it can be a whole myriad of things sometimes, but at the end of the day, it has to matter to them, right?
I have never been asked that in all my life of existence thus far. And I believe I'm hitting middle age. What's the middle age range? Wait, what's middle age? What's the middle age
I'm
range?
not gonna say no.
Okay. I believe I'm hitting the middle
Middle age.
age. I'm coming out of I'm getting into the 40s. We'll
40s.
say that. Okay.
Okay, midlife
Okay. Okay.
40s.
Midlife.
Yeah,
Midlife. I'm
yeah.
getting into the 40s. And I haven't been asked that. I haven't been asked that. And I can literally count on one hand how many doctors have connected with me by
Hmm.
saying, hey, what's going on? I haven't seen you in a while. What's going on? Or, like you said, complimenting on the shoes or something like that. And the thing is this, because I hear some individuals saying this, well, I'm too busy. I'm too busy to keep a record of what's going on or what have you. But like you said, just a compliment. Even if you don't remember because you come across so many people,
Hmm.
there's always a way that you connect because this is someone else's health. And you, as a physician, are in the healthcare field. It's a
Hmm.
very connecting type of industry,
It
period.
is. It
There is
is.
always some way. It's not rocket science to
Yeah.
figure out how to connect. And then, have you noticed too in doing that, the client, their guards kind of go down,
Oh,
right? They
absolutely.
trust you more. They're going to
Yeah.
listen. They're more in the flow versus maybe being so rigid. Not saying
Yeah.
everybody's rigid, but I'm
Sure,
sure y'all
sure.
come across many rigid situations.
Yeah, yeah. Oh, the shoulders drop immediately. Yeah, absolutely. You can just see the whole demeanor change, from that one interaction because it's scary being on the other side.
Hmm.
It's scary being a patient, like going into a doctor's office and maybe you've never met that doctor before, right? So we already kind of have, I think, these preconceived notions of what, kind of doctors and their personalities are. So it can be a scary time. So we want to try to make it as comfortable as possible. Yeah.
So, switching from that disengagement to connection is the first
Mm-hmm.
thing that I'm hearing. That is something that physicians can do. What about when it comes to their teams? Because I'm sure there's some authoritation. The doctor is the doctor.
Yeah.
The doctor is really the head of it all. How can they even support their burnout with their teams? Because again, if you're not connecting with the client,
Mm-hmm.
right? Their shoulders dropping, that's going to ease your burnout
Mm-hmm.
because they're
Mm-hmm.
going to be more in flow. And then when you go out to your teams and you really, need some things from them or from them to do, what do you often see? Like I said, the authoritative, I'm sure, but are there anything else that you see with those systems that you really help to support so that they can shift that you see between the doctor and their teams? Like
Yeah.
there's authoritative, but is there anything else that you see that you would like to address?
Yeah. And I think that kind of, goes along the line of the whole leadership development, right? It's
Hmm.
learning like what's your style? What's your leadership style? So, and if you are more authoritative, do you know when you're supposed to use that and not use it?
Ooh.
Right? Because there's some instances where, that just doesn't fly, right?
Is that
So, or is your style more collaborative? And that's wonderful. And you have to know again when to use that. So
Mm-hmm.
it's really learning those different leadership styles, which I think is helpful. So that kind of helps, I think, physicians to learn sort of when to use what style in what situation. Um, and then I think it's also just teaching. So for all of us, we typically have a lead person over our team, right? If we're in a health system, so it's really teaching that lead person, the person who is over, let's say, their physician team, because then
Mm-hmm.
that'll trickle down. But the person who's over that physician team, who's that physician lead, to help them to have or develop what I call coaching skills. So, how do you help a physician when they're in crisis, right? Do you just tell them, okay, well, maybe you need to just go, find out what resources, we have in our system that'll help you kind of get through it? Or do you help them sort of develop what would be their own internal toolbox of things that they can use
Mm.
in that situation?
Mm.
So what is it that I can do that will help you right now? Just a simple question. And a lot of it is just having those, eye-opening, I think, questions, or asking sort of those curious questions to our team members to find out really what's at the basis or the root of sort of what they may be challenged with. So by you having that sort of rapport with your team, now then the physicians can sort of use that same approach with their team members as well. So when it comes to the nurses on their team or whoever that they're working with, that they understand that that's the way to communicate and not, in an authoritative manner.
You all, as she speaks, all that so much comes up for me around. And what does this look like? And that's why you would work with her. Do you get what I'm saying? That's why she would come in, because I can just hear it now, right? That's why she would come in to support your team
Yes.
in doing so, because she can do that and even break that down. And it's so interesting because how you said the approach in the beginning was very much wellness. What you do is you break that down even further, because even with what you just said, I think mindfulness,
Mm-hmm.
but you're not
Mm-hmm.
able to just say, oh, mindfulness and your habits, because people don't know what that looks
Looks like,
like.
yeah.
You're literally giving those examples, those real life practical examples of what it looks like. This is something that you can do, but the deeper piece of how to do it and execute it and what this looks like, because Dr. Herbert's got to get to know you, see what's going on to transform it. Every single medical hub, right? Is it hub? Networks,
Network.
right?
Mm-hmm.
Every single medical network needs this. Every single one of y'all needs
Yeah.
this. Every single private practice doctor and physician needs this. The burnout is here. We are in a crisis, and Dr. Herbert has the solution to come in and to support you. If you are listening to this and you know a physician personally, send them this interview with Dr. Herbert. There is no need. We have a solution here. There is no need to keep this going on, because guess what? I'm going to get serious. Blood is on your hands. It really is. To hear this information, to know a physician, or if you're a physician in yourself, even if you're a nurse, whatever the case may be, to hear this and not share it and not to do something about it, you
Yeah.
have blood on your hands. Those lives that have lost, the blood is on your hands. And I'm not trying to be controversial. That's just the truth. Because now with this awareness, what are you going to choose?
Yeah.
What are you going to choose? The solution is here. What are some of the success? I'm sure you've had tons of success stories. What are some of the success stories that you have had with you going in and supporting them, basically reworking their systems, putting structure to it in a
Yeah.
very healthy way? What's some of that success that you have experienced? Oh, she probably
Yeah.
gonna make me cry. It's gonna be heartfelt. I love it.
I think Well, it kind of it varies, right? So a lot of times I'll go in. Sometimes I'm called to go in and just actually work with the leader,
Okay.
right? So it may not be a whole institutional
Starts at
change,
the head.
but it starts at the head. That's
Yeah.
where it starts.
Yeah.
So oftentimes I'll go in, I'll work with the leader, and they will be challenged with the things that we mentioned. Maybe they're challenged with their own burnout. Maybe they were challenged with, having an impact within their organization,
Mm-hmm.
leading a team, not quite sure how to do that at all. So one success story I did have was a medical director that I was working with, who was the head of their you know clinics.
Mm-hmm.
There were multiple clinics, and that medical director was charged with overseeing the clinics, overseeing the team, making sure that productivity was, obviously still maintained, but still needed to also take care of themselves, right? And
Mm.
not burn out in the process. And then I think that there was also some misalignment in terms of communication
Mm-hmm.
between that particular leader and then the administrators of that particular system. So it's creating a lot of friction, and things weren't moving, right? Things
Mm.
weren't moving as they should. So I came in, I coached that particular medical director, over a series of a couple of months in person and also virtual. I did work with the system in the sense that I have what I call an assessment period where I actually speak with their, direct reports, or the people who they actually have to report to as well, to sort of get a sense of, of what was going on. And after our time of working together, it became the highest grossing, clinic in that health system.
Highest grossing
Yeah.
money. Money. We know medical love money. Look, all of us
Right,
love money,
right,
but let's
right.
be real. So if nothing else grabbed your attention as it should
The
have,
bottom line.
the bottom
The bottom
line,
line.
the highest grossing, they went from not low grossing, like not gross, like where I know you gotta be very particular.
Right.
You can't, certain laws and certain things. But
Yeah,
can you
yeah.
kind of speak to like where they were to get to the highest grossing? Because I'm sure they were
Yeah.
nowhere close. I'm sure there was a big gap.
Yeah,
basically.
So there was a gap, and at the end of the day, I can give maybe a percentage. They increased
Okay.
their revenue by 30% or so.
30%
Yeah.
increase.
Yeah. Hired new providers, and new clinicians that worked in that particular clinic. They grew, had better, outcomes, were able to kind of bring on some other services as well.
They were able to bring on more services. The
Yeah.
burnout and the disengagement, working with Dr. Herbert, they were able to bring on more. Wow, they
it
were
was
thriving.
wonderful to see, because
Yeah.
this medical director started off being very,
That's
what I
amazing.
would call introverted, and
Okay.
not really, a people person.
Yeah.
And then ended up really just, gelling really well with their team. They would have monthly dinner meetings, which they never did before. Monthly dinner meetings. They invited their spouses to the meetings. So talking about decreasing burnout, when you can incorporate your family into
Yes.
your work life, right? That helps a lot as well. So yeah.
A complete 180 that is sustainable
Sustainable.
and no going back.
Yeah.
How does that sound? Doesn't that sound amazing?
Yeah, definitely.
Because the truth is, do you find, I would say so, but I want to hear from you being the professional, because with being a physician, it's a lot of school. It's a lot of money that goes into it with the
Yes.
test. And I heard some of them
Yes.
test prices. I was like, oh my gosh. So you truly have to want to do this and love
Absolutely.
it. So the truth is, if you got into it and you went as far as you did to be a physician, to do this, you had a love for it.
Yeah.
So would you say it's safe to say that you also support them in returning back to their love?
Oh, absolutely. Because I don't know anyone who would, like you said, put that much time in, the hours, the sacrifice, the money. I mean, a lot of physicians are, when they first come out, are in debt. $200,000, $300,000.
Oh, that's a lot of debt to come out of school with. Oh my
Yes.
gosh.
So
Yes.
who would just say, I'm done with that?
Yeah.
Unless it was really, not sustainable.
Yeah.
I don't know anybody who would just kind of just give that up just to say, okay, I'm done, you
Yeah.
know? Yeah. And most people, I think, like you said, who go into medicine, they have a passion for it. You know, they really are doing it because it's their love.
Mm-hmm.
You know, it's the thing that drives them every day to
Mm-hmm.
get up, you know, and go in and to heal. So, yeah, definitely.
What started all this, Dr. Herbert? Because you've been on both sides. What
Yes.
started this for you? Because you made a choice you saw the problem and you made a choice to be the solution to the problem. You
Yeah.
didn't just completely get out.
Hmm.
You
Hmm.
didn't let burnout take control or decide to get disengaged. You actually got even more engaged. You got boots on the ground with this.
Hmm.
How
Hmm.
did this come to be?
Yeah. You know, I think twofold. I think one of it definitely was part of my lived experience. You know, so, you know, growing up in the inner city of Brooklyn, you know, the reason why I went into medicine actually is because my grandfather, who I had lived with when I was younger, I lived with my grandparents and my parents. So, like, extended family situation.
Yeah.
My grandfather died at the age of 50 from a massive heart attack,
Whoa, that's young.
very young.
Yeah.
And I rem- I don't remember saying this. I remember what happened, but my mom said that at that time that I said I wanted to become a doctor because I didn't want this to happen to any other family member, right? And back then I didn't know anything about health disparities or health equity, but now looking back, you know, on my life, I realized that that was at the helm of what happened to him, right? So fast forward, pushing through and then going to medical school, graduating, becoming a family physician. Now, being on the other side, I actually experienced burnout myself. So, when I was probably about 15 years into my practice, you know, I had a private practice at the time, I went through burnout. So, I know what that felt like. And it was not a great feeling. I
Mm-hmm.
mean, when I came on the other side of it, it was like night and day. I can't even explain to you sort of really what that feeling really feels like because it's like just you feel depleted. It's like an emotional exhaustion that just does not ever go away. And until I recognized that's what it was actually my daughter that kind of prodded me
A child will do it. I mean, even if she
and tell
grown,
you the
like your own
truth.
children will do it.
Yes,
Yeah,
yes. She was
yeah.
12 at the time, around the age of 12.
Wow.
And she was like, Mom, something is wrong with you. You're different. You know, we don't spend time together anymore. She gave me this whole speech, but
Wow.
that's my daughter. She gave me this whole speech. So it made me want to find out for myself what was going on,
Yeah.
you know? And then so I started to talk to someone. A friend of mine recommended that I get a coach. So that was the first thing.
Coaches are
Coaches are
amazing.
amazing. And as physicians back then, we didn't have access to coaches. I didn't even know what a coach was. So I had access to the coach and then started talking with her, and it just transformed my life. I mean, it really did. That with a little bit of counseling, you know, as well, which I think is important, helped me to realize that I wasn't alone, that there were a lot of other people, especially my colleagues, who were going through this, and it made me want to really bring awareness to it at that point. So I think those kind of two lived experiences is what kind of pushed me to want to do this and solve, find a solution.
As we close, is there anything else that you would like to share that you're really wanting to share in this moment on the Zen Effect show?
Yeah, I think if I want to share anything, it would be that it takes a village, right?
Yes, it
It
does.
takes a village to not only make sure that each of us are experiencing healthcare in the way that we should, but it also takes a village to help the people who are on the front lines doing the healing work to make sure that we are still here, healthy, and able to make sure that we have healthy communities.
And that's how because we are in command, right? We're not in control of everything, but we are in command. And in the midst of everything that's going on in the world, in the midst of the crisis and the burnout, we can be in command, number one, when it comes to ourselves and also when it comes to our warm circles as
Yeah.
well
Yeah.
by doing this. For those who are interested in working with you, those physicians that are listening, now, do you just you work with physicians, you work with leadership, do you work with, what about nurses? Like, do you,
Oh,
just everybody
absolutely.
in the
Yeah,
medical?
yeah, yeah.
Okay.
Yeah, my
Okay.
focus has, certainly been around, physicians and health systems, but
Yes.
certainly I have worked with nurses in the past as well. So
Okay.
anyone in the healthcare industry.
How can they get in touch with you? How can they connect with you?
Yeah. So the best way to get in contact with me would be to go to my website. So that's justtherightbalance.com.
Just the right.
Yes.
I love it. That's perfect.
Yes. And I have a contact section. So it's justtherightbalance.com/contact. You can fill out a, informational with your information there. And then I will definitely reach out and get back in touch with you. So justtherightbalance.com is my website. And I'm on all social media, Dr. Lisa Herbert.
Do you answer DMs?
I sure do.
Okay, so you hear it. She gave you, yes, the contact section, but she will get in touch with you. You're not just I say that because, some people you don't hear back.
Yeah.
She will get in touch with you, okay? She will get in touch with you.
Yes.
I love this. You all, wow, so much insight has been provided here by Dr. Herbert.
Yes,
This has been
thank you.
absolutely
Thank you so
beautiful.
much.
My question to you is this. What's alive for me in this moment is what I said earlier. We are creating so much noise and so much talk around what's happening in the medical field. We literally receive so much insight. Dr. Herbert literally took the curtain and opened it up to say, this is what's really going on. And this, from what I'm hearing from her, is truly the foundational issue that's creating everything else. It's the tree, and things are branching off of the tree. So instead of a question, I'm actually going to give you a call to action. If you are in the medical field, contact her now. If you know someone who is in the medical field, share this with them. And when you share it, literally send them a text, hand it to them, her contact information. Let's start making a change and making a difference in our healthcare system. We all talk about, we will go back in the days where, there wasn't portals and things, and they connected with you, and they even crafted the medicine right there, and they had that connection. Well, guess what? It's not lost. Now, there's more technology. They may not sit up here and craft everything for you, right? However, we can get back to the nucleus of that. But how we do that is by sharing this message and calling and contacting Dr. Herbert for her services. Because it's a domino effect. Just how it started at the head with them being burnt out and it trickled down to the rest of your team burnt out. Now all your team done left and you don't know what to do. 2, working with Dr. Herbert and having a 30% increase. Okay? Making more money, having healthy and happy clients. Because guess what? When they are, they're going to stick with your services, right? And that makes you feel good because you're in the business of caring for people. You all, let's continue this conversation on my Patreon. Visit my website, www.thezeneffectco.com. Let's really talk about this. Any questions that you may have, what have you, let's keep this conversation going. That's what the inner circle is all about, you all, on Patreon. The small investment that you make on Patreon supports you in investing in yourself. Take what resonated with you today and carry it throughout the week. Working with Dr. Herbert is going to support you and your teams, or just you, because you may, be a nurse, what have you, may not have a team, in your aura being able to speak before words do. Maybe in the medical field you want to move up and you're not able to because you're burnt out and you're disengaged. Dr. Herbert can support you and may get you in a higher position due to that inner balance where you're making more money than you could ever imagine and helping people at the same time while doing it so everybody can benefit. Always remember to keep your soul hydrated and your spirit fortified. Until next week, stay elevated. Thank you, Dr. Herbert. This has been fantastic.
Thank you so much.
This is going viral.
So much.
This is going viral. Yes.
This was a great interview, and
Awesome.
I appreciate you just putting all of your enthusiasm into this,
Of course.
And sharing it with your audience.
I love that you had a great experience. That's such a compliment
Yes.
coming from a doctor, too, because they don't play, honey. Yeah, they do not play. They do not play. Oh, would you like to get a picture? Let's get close, Dr. Herbert.
Yes.
Yeah, they don't play. They keep it real. Yes.